Okay. Ladies and gentlemen, good morning. My name is Alessandro Pepino. I work at University of Naples, University Federico II, quite a large university, and I am a professor of biomedical engineering. I started as electronic engineering many years ago and got a PhD on biomedical engineering. And in the latest year, in the last 15 years, I'm working deeply for supporting ICT in the health companies, hospitals, and so on. And so I recently working on starting from a practical experience, because I worked as consultant 10 years in a hospital with my students in order to supporting an ICT infrastructure. Following this experience, I started to look at the organizational changes, because I realized that in the changing of health services is not so important the technological point of view, rather than the ability to improve the organizational workflow. And so I asked myself and looked for which would be the tools, the instruments for supporting the organizational change in the health companies. And that's what I talking about this morning. So, what mean to improve health services? Look for safety or for patient satisfaction, or say, of course, concerning the cost, and least but not least the employee moral, in order to improve their quality of life, also for concerning the employee. That's above all can talk about quality in the health services. And how to improve quality in this point of view? You have to change your organizational model. But this seems easy to say, but it is really difficult to do that, especially because you have not really practical tools. When there are many people in Italy and that talk about the organizational changing and so on, a lot of methodologies, but sincerely speaking, there's very theoretical. There is not practical tools, no clear practical view in order to change the organization. And it's a crucial problem, because you cannot improve the quality, you cannot reduce the cost, you cannot make the life of patient easier in the hospital if you cannot change the organization, if the organization remains the same. And in Italy, but in my area especially, the organization does not start from precise design of that, but just as a sort of tradition that starts in when that department starts in the year, and not formal, not a rigorous approach. So any change involves a difference in the way our organization works, in its member or its leader. The form it takes how to deploy these resources. When you talk about the organizational change, you talk about that how the resources day by day works. And that's a big problem, because when you change how people works, you have to talk about their feeling and the syndicate and so on. It's rather complicated. So you must be safe that the organizational change really works. You cannot make mistake. You cannot change how people works and then make a mistake about that. So that is quite difficult, and you need something that is a possibility to accurately predict the consequences of these changes in order to check if it works or not. And it's not enough to make some number on Excel spreadsheet to convince the management concerning the change. of many peoples. So the BPM technologies, and in particular discrete event simulation, help to improve the organization in this change. From general point of view, they provide a number of tools mainly based on ICT technologies. Excuse me, above all, which is the deadline? How many times I have for my speech? 12 minutes from now, from the beginning. Okay. So more or less the workflow, that the basic idea is, of course, start from analyze the organizational system, the organizational workflow, and then to simulate it by a technical tool, by BPM tools. Why simulate means to reproduce the behavior of the organizational system in an artificial way, and we look for how. After the simulation, we have to test, we have to validate it if the simulation model is as close as possible to the real model. That is not easy job. There are a number of statistic techniques and so on in order to check if these are as close as possible. And finally, you can improve the system on the basis of simulation system. Of course, many cases, in some cases you can check the improvement. So you can check the improvement on the simulation and then reanalyze it in order to close the tool. So the BPM and simulation are new technologies and based mainly on ICT, and they found their origin on industrial applications and logistics. They are currently used for airport and so on. Well, now, because why now and not 10 years ago? Because at least in Italy, 10 years ago, nobody could accept the fact that the health system could be treated as an airport, for instance, or as a manufacturer company, because they said that the health companies are different. The health companies cannot manage like a normal company. You cannot measure the health system. 10 years ago, all the managers said that nobody was able to measure in health companies how it works. Now it's different. Now, after 10 years, after a change of change of point of view, is accepted that the health companies, the health workflow can and must be measured in order to preserve the quality, in order to increase the quality, in order to reduce the cost. You must measure it. And BPM technologies provide the tool for measure the organizational system, and particularly health organization. And of course, it's important in the analysis to outline the KPI, so the performance index where you work about, because it's impossible, of course, to simulate everything, to simulate any behavior of the health structure. So you have to outline which are the key performance index you are interested about, and create a simulation model concerning that KPI, and in order to check, to validate that KPI, in order to get the information that we need for that KPI, of course, are related to the improvement that we are looking for. Okay. And how the discrete event simulation is, there are a number of technical tools. That's, I show you a tools, a UK tool that's named Simulate, but there are a USA tool that's Simio, and another is named Arena. They're different. There are this tool, for instance, use just a few abstractions. That is the input that generates some work items that are an entity that can be labeled with the property of the the unit of work, for instance, patients, for instance, calls, for instance, asking, any entity that that is related to the workflow that you are designing to. Usually in the health structures, the work items are the patients, for instance, but for a call center would be a telephone call and so on. Then a queue, that is an entity where all the work items are stored in waiting for the activity that's to be carried out soon after. And you imagine that any activity has a queue behind in the real practice. And this is important because it is allowed to measure the waiting times and so on. Then the activities, that is the main item work center, that can be qualified about the time that it takes to make an activity, and there are the resources that can be linked to that activities in order to check how much time has been spent by each resources. And finally the endpoint that collect all the work items in order to measure how many work items have you processed during the workflow, and to measure how much time it takes to make all the workflow. Okay, I go very quickly. That's overall the workflow design, validation, and you can check if as is you measure how is the process or how to be the process in the what if. More or less, this is the result of integrated work where a team of people that comes from different knowledge works all together in order to design and validate the workflow. This is just an example for laboratory that is a typical workflow in health structures. So, for instance, for that workflow, the KPI of number of jobs, the timing that it takes for process the laboratory samples, and so on. That's the activities linked to the resources, and this is how a model looks like. And this video shows how the model works. This looks like a sort of, or it's not a static diagram, because it's a living diagram where the start point generates the work item, that the flow as this starting from a number of real work items that is qualified. As you see now, these work items are flow into the process. Look at the queue that leaves showing real time how the work items are stored inside, and really the work items flow, and each bolts is a work items that go into the queues, then the activities, and so on. And this is a living activity, and you can measure how the system works inside in real time, how much is spent each part. So you can really you don't look just inside before and after above all, but you can look inside each part of the system, how it's working. And there are not other tools, and important things that the people that works with you with analysis, the medical doctors, the managers, and so on, are able to understand it, because the medical doctor is used to look to something that is alive. He is not able to talk about theoretical point of view on just a number. He needs something that works, something that lives. And the simulation tool is quite, similar to what he is usually able to see. So at the end of simulation, we got a number of KPI that in the validation phase you have to match to the numbers, to the observation that you make in the real model. So in the validation you make an open box when you validate just as with medical director, managers, nurses. you look more or less how the system is designed and how it works. And then then you can look in the black box inside each KPI how is close, how much is close to the observation that you have to make on the real system. Okay, more or less these are results for these experiments where we did some observation, and that's the outcomes of the model that's been compared to the real one. Conclusion: the discrete heavy simulation is an effective tool for sharing the change management, because you cannot obtain any management by one side. You have to work together with people, medical doctor, managers, in order to discuss about that. And this model is an effective tool to discuss with them, to educate people about the organization, to understanding what's mean a waiting time, what's mean a queue, what's mean a time, what's mean the work about the resources. And I can tell you that my experience, I have several projects that managers appreciate the opportunity to look inside the system, because they have no other chance to do that. Of course, in a sort of on the table, not going inside during day by day, because it's easy. But how it's possible with many departments to go every day into each department to measure or to evaluate how people works, how the process works. Of course, the information system database, at least entry point information, are essential for validation. Otherwise, it's too roughly. And the last and the not least point, that the commitment from the chief management and the awareness about these new tools are, by political management side, are crucial to get an effective change management. Because my experience in many cases, people does not want really change. They talk about they want to change, but that's not really. And so it's important to solve this problem. Okay, thank you for your attention.
Thank you very much for this presentation.
Any question? Okay.
How you select the parameters to decide the quality, the evaluation of the quality is too complex, so many things involved. How you determine which of them are really significant at the end of your analysis?
By a number, during the analysis, the interview with the managers, you create a draft. After the first draft, you check it several times with them.
How many in the first draft?
How many? It depends by the complexity, but the analysis more or less take 4 or 5 meetings, more or less, in order to really understand. After that, you go to the final draft, and you have to measure it physically in the real cases. But more or less, there is not a strict rule, because it is strongly depend by the complexity, because there are a number of workflow that are more or less easy to measure. For instance, the outpatient, the scheduling for emergency department. There are a number of areas where the workflow are more or less well known. There are other areas, for instance, the workflow concerning the bedside care of the patients, that are much more complicated, and where it depends because any department, any clinical department has different aspects, different rules. Now we're carrying on an experience with in medicine, immunology, we did another one in surgery department, and there are a completely different situation. But the nice thing is that it's the opportunity for the director, for the management to discuss about. So to start to make something about that otherwise was especially because in many cases there are not information system. Because if you get there are information system really operative, because if you had in the ideal case an information system based on process where you can keep the log and measure the several steps of the process, would be easier. But at the moment the most of information systems are databased, and so you are not aware about who is doing, when is doing, and so on.
Okay, thank you.